More than 2,000 people have blockaded London's Westminster Bridge in protest over the government's plans to shake up the NHS in England. The demonstrators, including health service workers and anti-cuts campaigners, said the proposals will be bad for the NHS, for patients and society. The Health and Social Care Bill is due to go before the House of Lords this week. Jane Death reports.
Block the bridge! Block the bill!
Doctors, nurses, patients. They met on Westminster Bridge to try to put themselves between the Health and Social Care Bill and Parliament's statute books.
Who's NHS? Our NHS!
To me, this means essentially the end of our NHS. This is heading full on towards privatisation.
NHS!
The government says the bill would open up the NHS in England to healthy competition, equalling more power to the patient and better care. After some redrafting, the bill did make it through the House of Commons. These protesters want the House of Lords to kill it off.
Demonstrating on this bridge is symbolic because it links one of London's biggest hospitals and Westminster, where the Lords will debate these NHS reforms. The aim is to cut off the blood supply to this controversial health bill.
John Ashton is Cumbria's Director of Public Health. He told me he's scared private companies will strip the NHS of the profitable bits, leaving what's left to rot. He said peers mustn't let it happen.
Once they pass this legislation, very large parts of the health service will have to be opened up to provision by anybody from the private sector. Big American companies are likely to come in.
What's wrong with that?
What's wrong with that is that they will cherry pick the things that make a profit easily, things like hip replacements and all of that kind of stuff. What they will never be interested in are the expensive and complicated things.
The NHS workers here said they'll lose the trust of their patients.
I work in the NHS not for profit, not for a big buck, not for a big wage. I work in it solely to look after my patients. What I don't want to see is that changed. I don't want to see the profit motive brought into healthcare.
It looks like some peers will agree with him. They want the health bill sent to a special select committee for closer examination. Labour want it ditched completely.
It unpicks the fabric of the NHS. It takes the N out of the NHS and turns it into a free-for-all, a huge postcode lottery. And we're not prepared to accept that.
They said cut back! We say fight back!
The Department of Health today insisted its push for patient power, clinical leadership and a focus on results had wide support. And without this bill, the NHS won't have a future.